When I think about Tamir Rice and Michael Brown and the long list of folks that had us marching in the streets, when I think about the fact that we're dying and some people don't care, that quite frankly, some people don't care that Black and brown people dying of COVID-19. And this is America too. I want to say to everybody on this call, we got to mobilize, we got to organize. You need to get down with BECMA. You need to reach out to Malia and see what you can do to support the work that she's doing. You need to join the Urban League, the NAACP. This is not a time that we need to sit on sidelines and wait for somebody else to do it. If not you, then who?
Welcome. I'm Leon Wilson, President and CEO of the Museum of African American History in Boston. In response to an economic crisis associated with freedom from slavery, Boston's free Black community met in our very own African Meeting House, home of the Museum of African American History. They met to develop strategies and activate solutions to economic inequity. Tonight, once again, we meet under similar circumstance relative to economic inequity. We invite you to join us in our virtual conversation series, Race in the Public Dialogue, the economic impact of COVID-19 on the African American community. Leading this discussion is Crystal Haynes, reporter for WFXT Boston 25. She also has a group of panelists with her, and she'll be taking you through a very interesting dialogue around just the issue I mentioned a few minutes ago. Those panelists include Malia, Lazu of Berkshire Bank, Segun, Idowu, Executive Director of the Black Economic Council of Massachusetts, and Michael Curry, Deputy CEO and Chair of the National NAACP Advocacy and Policy Commission. Crystal?
Welcome everyone who has joined us here tonight, and we hope you invite others to come into conversation with us as we really tackle some serious issues. We know the Black and brown communities have been disproportionately affected by the COVID-19 pandemic, and we really want to dig down on the issues that matter to you. You heard Leon introduce some of our panelists, and we're going to start with Michael Curry as all of the panelists go ahead and talk about a little bit about themselves so you can get to know them and we can frame this conversation.
Thank you, Crystal. It is first an honor and a pleasure to be on tonight's call. I want to thank the museum. I'm a lifelong fan of the museum and the leadership there. So thank you to Leon and the staff for convening this conversation. I am a Roxbury kid. I was born here in Roxbury in Boston, raised in Lenox Street housing projects, right in towards which some call the South End. We just called it the Berry. When I was growing up, went to Boston Public Schools and had the opportunity to go on and do some pretty amazing things. I am on the national board of the NAACP, and I chair the Advocacy and Policy Committee. That's essentially like the Ways and Means Committee of the national board. So every programmatic committee of the National Association, housing, education, healthcare, environmental justice, the chairs of those committees sit on my committee, and we get the weighty work of dealing with these really significant issues in the country. I was the Boston branch president of the NAACP from 2011 to 2016. And then my paid full-time job is I'm the deputy CEO of the Massachusetts League of Community Health Centers. So I get to represent 52 community health centers, over 1 million patients across the Commonwealth, practicing out of 304 practice sites. Thank you.
Well, I'll echo what Mike said of thanking the museum for not only the invitation, but having this conversation tonight, this crucial conversation. Born and raised here in the city of Boston as well, not near Mike, but grew up in Dorchester, but spent a lot of my time on the second pew of 12th Baptist Church and in Roxbury. And so, even that experience brings me a little closer to the museum given their ties together. So, as mentioned earlier, my name is Segun. I have the privilege of serving as the executive director of the Black Economic Council of Massachusetts, or BECMA. This organization serves as the Chamber of Commerce for Black businesses across the Commonwealth of Massachusetts. We were founded about 5 years ago, partly in response to a report that came out of the Federal Reserve Bank of Boston that talked about the racial wealth gap in the greater Boston area. And one of the statistics in that report that is now famous and continues to shock non-Black communities every time they see the statistic that the median net worth of the white family in greater Boston is $247,500, and the median net worth of the Black family is $8. Because of this statistic and many of the other pieces of information in that report, there were a number of meetings that happened in our community, all solutions focused. And one of the things that came out of these conversations was the establishment of BECMA to be a resource and an advocate for Black businesses across the Commonwealth, because of the understanding that if we're going to address the racial wealth gap, we need to make sure that we're investing in establishing and supporting Black businesses, because this is one of the ways to build wealth, not only for families, but also entire communities. And so to date, since the founding, we have roughly 300 members across the state of Massachusetts, and we serve our members and all Black businesses in 3 different ways. We advocate for public policies that are going to impact and grow our businesses. We convene solutions-oriented conversations or support and participate in those types of conversations, which we are happy to do tonight. And finally, we connect our members not only to one another, but to important opportunities like contracts in the private and public sectors. And one of the ways we did this was last year in November of 2019, we held our inaugural Mass Black Expo at the Convention Center, where we were able to bring 1,000 people together over the course of 2 days and to connect 60 different Black-owned businesses to new customers and different corporate partners. So these are some of the things that we're doing. And again, I appreciate the opportunity to be here tonight.
All right, Malia, take it away. Tell us a little bit about yourself.
Absolutely. And again, thank you so much to the museum, to WGBH, to you, Crystal, for joining us with this conversation. It's wonderful to be on a panel with folks who I admire, respect, and have the pleasure to have been in the streets with. I'm originally from Hawaii, and it was folks like Michael Curry that brought me in to the community and showed me that there was some great work going on here. So I was blessed to meet him many years ago, and the Boston community, and have really been dedicated to helping ever since. I'm originally a community organizer, but I'm now a banker, and really focused on, I'm the Chief Experience Officer and the Regional President of the Greater Boston area. And I'm really focused on how can banks show up for communities of color better, with more respect, and really how do we bank everyone with dignity? And so we're doing a lot of different community pilots. We've opened a free co-working space in Nubian Square, and we're about to take our co-working space and programming online. We're also doing community underwriting for small businesses. So really trying to pilot a good model for banks and community banks moving into the 21st century. And I'm looking forward to talking tonight.
Malia, thank you so much. And so to frame our conversation, we're going to go ahead and start with Michael.
We thought it was very important to start this conversation off tonight with a little bit of history. As we talk about the economic impact of COVID-19, it's important to understand this is a pandemic. And this is not our first pandemic, not here in the United States and not globally. And there's a context for how the medical crisis that we're facing impacts our economic situation as well. So I'd like to jump into the slides if I could, and just run through some quick slides that'll provide a little context for tonight's conversation. So one of the things we know with the pandemic is it hits the poorest people first. It impacts them disparately. They suffer the most. Probably the greatest example of that as we talk about this pandemic is the 1918 flu pandemic. We always should start with the history lesson on this stuff. The Spanish flu, also known as the 1918 flu pandemic, was an unusually dead influenza pandemic that lasted from January 1918 to December 1920. Contrary to what President Trump often says, it was a 1917 flu pandemic. We always know that he's a little off on his history and his facts. But as you'll see here, 1918 and 1920, we were in the grips of a pandemic in this country and across the globe that infected over 500 million people worldwide, over a quarter of the world's population, with 5 million deaths, and that's 675,000 just in the US alone. In 1918, we had not yet discovered flu viruses, no lab tests to detect those viruses, no vaccines, and there was poor infrastructure generally, not just in communities of color, not just for poor people. We didn't have the life-saving tools. We didn't know what a ventilator was at that point. Because of Jim Crow, we were only a few decades out of slavery. There were deplorable living conditions, lack of access to health care. African Americans were extremely susceptible to the outbreak of this disease. You'll see there on the right side some of the conditions then and now, chronic conditions, housing and food insecurity, financial instability, lack of access to supplies and medical supplies. There was an incarceration of people of color that was equally as significant during that time period. We don't know what the death toll was, and even though there's some data and there's some research that I'll talk about in a second, we know that we were in the grips of a world war at the time, which is why this pandemic spread across the globe so quickly, is because soldiers, particularly the soldiers, United States soldiers, were traveling throughout Europe, and that virus was spreading as they went from town and village to village. Data then and data now is an issue, and we'll talk about that in a second. Most importantly for this slide is we need to understand history. One of the reasons that it's called the Spanish flu is because, similar to what we see playing out today, people didn't want to recognize that the flu was a real condition in their countries. And it was Spain that was one of the first countries to really step forward and acknowledge that there was a problem. Therefore, it became entitled the Spanish flu. But we know that the flu really was gripping all the countries across the globe. It was just Spain that sort of stepped forward. Next slide. There's a saying in the Black community, and Segun and Malia know this saying, that is typically used in an economic sense, but I think it's interesting now. They say when white America catches the cold, Black America catches the flu. And I ask the question, what happens when they catch the flu? Next slide. Let's not lose sight of what's most important here. I think as we get ready to talk, and Segun and Malia, who are amazing with the experience and the knowledge they have in the economic space and in banking and in business development, will share with us. But I want to start with what's most important here. Let's not lose sight of the lives that are being lost, the families that are being impacted. So you'll see there just a quick reference to the numbers today. Over 5 million cases worldwide, over almost 330,000 deaths worldwide. Those are real lives. Those are families that are devastated. Those are lost opportunities. That's lost contributions to families. Over 1.5 million in the US with over 93,000 deaths, almost 94,000. And you'll see the data there for Massachusetts and for Boston. I serve on the Boston Health and Equity Task Force. We look at these numbers regularly to see what's happening in the city and to develop mitigation approaches to address the death and sickness of people of color that are dying and suffering at a higher rate. Viruses continue to spread, although it's leveling off in many locations, and the state has begun to reopen like much of the rest of the country. And I think there's a caution there. Reopening comes with risk, as we are walking away from social distancing, and we could be here again in a few weeks, or potentially if the pandemic returns later this fall, as it did in 1918. Interesting note, in 1918, the flu hit hard in the spring. One of the arguments historians have is it hit so hard that it hit the Black community first. And many African Americans at that time who lived in deplorable conditions were really impacted. And now you know a term that's been said quite frequently, which is herd immunity. There's an argument by researchers that there was heavy herd immunity at that time, and African Americans, when the disease came back in the fall of 1918, more deadly and mutated, less African Americans died. Just talking quickly about really the pillars of how we address this pandemic: testing, tracing, tracking, treating, and isolating. Next slide. We know that it's playing out on race. Black Lives Matter. So we all say all lives matter. People said that as sort of a retort to Black Lives Matter. When it comes to a pandemic, yes, all lives matter, but let's have a conversation about Black lives that are disparately dying because of the underlying issues that have always been here but have gone unaddressed. Next slide. You'll see there some advocacy by our Congresswoman Ayanna Pressley and Senator Warren around collecting data and trying to address the underlying systemic issues. Next slide. You'll also see here that it's across the globe, across the United States, that this is really devastating communities in Michigan and Philly, and it's playing out very much along race and class. Next slide. You'll see this is a pretty old slide, meaning a few weeks old, and these numbers may have dramatically, but wanted you to see that Michigan and Illinois were hit pretty significantly along racial lines. And of course, those same numbers play out here as well. Next slide. Nothing can be solved that can't be faced. That's a W.E.B. Du Bois quote. So whether it's slavery, Reconstruction, the lost promises of reparations, the Depression, the Great Depression, and the impact that that had on the African-American community, or the Institute of Medicine's unequal treatment, the argument that doctors and doctors and physicians don't treat African-Americans and Latinos the same as they do others, are all worthy of discussion, both when the report came out in the early 2000s and today as well. Last but not least, there's a lot of economic impacts that I'll talk about as we have the discussion, but I want people to remember, one, the context of that this is a pandemic with real lives being lost, and then two, we'll talk in a minute about the impacts that go beyond just businesses, that are like real impacts that individuals have with lost income, lost wealth, as well as lost access to programs and services that we depend on. We'll talk about that in a minute. Segun, I think I'm tossing it to you.
Thank you very much, Michael. And I very much appreciate that helpful framing and adding the history to this discussion. When I think about, so the title of this talk is about the economic impact this is having on the Black community. And, I'll say a little bit about what this is doing to Black businesses here in the state of Massachusetts. Back in March, we had to pivot and that's the buzzword of the year, is pivot. So you'll hear that word a lot tonight. But we had to very quickly pivot to understanding exactly that, what the economic toll this pandemic was taking on our businesses. And so we sent out a survey to our members on March 9th, which was a couple of weeks before the state of Massachusetts issued a stay-at-home advisory, cautioning everyone to stay indoors. And even at that time, we saw that this pandemic was having an outsized impact on our businesses. And, we surveyed our 300 members, and what we got back, it wasn't shocking, but it was concerning regardless. It showed us that 90% of our businesses at that time, before everyone was taking this very seriously, were experiencing a significant to severe financial impact because of the coronavirus. And over 60% of our businesses reported only having cash reserves to last up to 90 days if the state were to shut down. And so that's important to think about, because this was on March 9th. That was almost 90 days ago. And so we know that a lot of our businesses at that time were in a tough place, but today are in an even tougher place and are struggling to keep their doors open. And finally, 43% of our members reported that they would have to let their staff go in order to try to survive this pandemic, however long it lasted. Again, that was back in early March. And so we know that with the state reporting north of 1 million folks on unemployment or filing claims for unemployment, that 43% has jumped significantly. So, we know that that this is having a huge impact on our membership. And so we've been able to, part of the piece of what we do is advocacy, and have been really fortunate to have been able to work on the federal, state, and local levels in order to get resources to our members. You know, Michael mentioned the work that Congresswoman Presley has been doing, as well as Senator Warren, and we were able to push out an op-ed in the Boston Globe about the Paycheck Protection Program, which was a really poorly designed effort to try to get resources to our businesses. And we, partnered with Eastern Bank and with the Initiative for Competitive Intercity and with Amplify Latinx to be able to let folks know, particularly those in Congress, that if we want to really address this matter, we need to set aside funds for specifically for Black and Latinx businesses. We need to provide technical assistance. And we need to collect the data to know that these resources are going where they need to. But at the end of the day, all of this advocacy that we do on the federal, state, and local levels, all of those recommendations boil down to this one notion. There are, according to US Census data from 2012, we know that there are at least 1,200 Black-owned firms here in the state of Massachusetts that employ 14,000 people and contribute billions of dollars to the state economy. All of our recommendations boil down to the fact that we cannot afford to let our Black business community fail. If we want to have a strong and healthy economy, we need to make sure that we have strong and healthy Black businesses. BECMA joined a coalition called the Boston Black COVID-19 Coalition. And one of its members, Senator Diane Wilkerson, often has been saying in the last few weeks that if we're reading in the papers that the US is expecting at least 25% of Black business, of all small businesses to fail, we should expect to triple that number for Black businesses. And the senator is correct that, we should expect that if we don't do anything in this interim process to protect and save our businesses. If nothing is done to protect these businesses, we will absolutely see the largest increase of the racial wealth gap in our time. And this would be a tremendous loss, not only for our communities, but for the entire United States of America. McKinsey and Company published a report a month ago that showed us that if we were to close the racial wealth gap in this country, we would add $1.5 trillion to the national economy every year. We need to really think about that. And at the end of the day, too, what we note is that, though we be daily crucified as Black business owners, as Black people in this country, we are also its savior. It was the Brookings Institution that pointed out in April of 2020 that after the Great Recession, it was actually minority-owned businesses that saved the American economy. What they reported was that between 2007 and 2012, even though Black and brown businesses were the most likely to close their businesses, it was actually these businesses that added 1.8 million jobs to the national economy. At that same time, it was white-owned businesses owned by males and females equally that lost 1.6 million jobs. So we know that when we invest in Black and brown businesses and in Black and brown communities, that we are really investing in the future of our entire economy and of the health and safety of our entire community. So when we think about the economic impact that this is having on the Black community, I think we really need to start thinking about what the economic impact will be on the entire nation if we do not get right our ability to save these necessary institutions like Black businesses in our communities. And I think I'm going to also invite Malia to share her thoughts.
Thank you, Segun, and thank you everyone for joining. Like Michael, and we can go to my first slide, I like starting in history as well. And one of the things that, one of the quotes that just kept on coming to my heart throughout this whole process is a quote by King that says, either we go up together or we go down together. Let us develop that kind of dangerous unselfishness. And when you look at what happens in communities of color, in Black households, when it comes to recession, I think Mike and Segun also laid it out beautifully, but you can see the numbers here. We end up losing more and we don't gain it back. You can look at other, other catastrophes, whether that be Katrina, other hurricanes, and you'll see the same thing. we don't bounce back in the same way. And I think that's something that needs to just be stated as we plan. You know, we can't expect that the same tools to have the economy bounce back is what's going to have us bounce back. And I would also say that I think it's important for us to understand that if we are going to get back to where we were, which we will all say is still not enough, that we're going to have to do it together and with ourselves. So I also want to just highlight a couple of the reasons why our wealth is so vulnerable. The first is that we lack generational wealth and generational stability. And that stability really sits in homes. When you heard Segun's stat on $8 versus $250,000, that's about home equity. And equity for a home can allow families to go to college, can open businesses. So you really see the latter sort of start in wealth creation with a home. The other thing is that we don't see Black money staying in Black communities. And I think now with the work that BECMA and others are doing to highlight Black and brown businesses, we can find a way to keep our money in our community for longer than 6 hours, which is how long the average Black dollar stays in the community. And lastly, I just want to highlight that our economy is different. We have, you know, working class people. We have a lot of sole proprietorships. We also operate in cash and gift economies a lot. And those things aren't really captured by the normal economy as we talk about it. So I want to talk about, next slide, please. I'd love to talk about what do we do? And this isn't rocket science. It's definitely something that we're wringing our hands about because we don't seem to solve the problem. But I think if we stop, we can realize that the problem isn't being solved, not because we don't know the plan, but because the lack of will for institutions to shift and really focus on their bias. And so some best practices that we see and that we've learned from working with others is that the first thing is that minority businesses, people of color must be center in creating the solution. I think that there's very well-intentioned plans, but if you don't fully understand the problems that communities are facing, you're going to have trouble building solutions. The second thing, and this really goes around how we redefine capital flow, we have to redefine risk. And what that means is normally when we give people money, we say it's because they meet a certain criteria. And that criteria is really fraught with a lot of bias. And so it's important that as we rebuild from COVID, that financial institutions start redefining risk so that they can flow capital to more people. And then lastly, as I said before, you know, we need to make sure that people of color are having every opportunity possible to own a home. It is the #1 way to build wealth. Next slide. So as I said in my intro, I'm not an organizer, or I am an organizer, I'm not really a banker. And one of the great things about being an organizer in a bank is that you can see what's possible and really what banks can be doing, especially you know, a community bank. And so I just want to talk about some of the work that we're piloting. And if anyone wants to know more about it, or if other banks want to do something similar, please reach out. So the first thing is that to get to redefining risk, we're doing community underwriting. And what that means is that the bank doesn't do the pre-approval, but a group from the community does. And so it still has a due diligence process, but not in the same way. And we also have co-working space that we would love for people to see and check us out online. And lastly, as a bank, I think it's really important that we work with minority banks and community deposit institutions to really be able to drive capital into the streets properly and be able to bank everyone with dignity. So as I close with my last slide, which is a shameless plug for 2 events we're doing, I just look forward to continue the conversation and see how we can help bank everyone with dignity. For those of you watching, Segun and I definitely have done this a lot. And one of the things, Segun, is I would love for you to just talk about a little bit about what it's like, you know, supporting organizations and finding these different ways to drive capital and support to the businesses.
Well, you know, well, I appreciate the question. And like you said, we've been on, this might be our, fifth one in like a couple of weeks, but it's important conversation. And, you know, we're both excited to be here with the museum and WGBH. In terms of supporting, you know, different businesses, I have to tell you, it gets tougher and tougher each day to connect our folks to different forms of capital. You know, I think of the PPP, or the Paycheck Protection Program, and how in the beginning, you know, there was a lot of concern about whether or not people were eligible to apply. And then now folks who did apply are worried about the forgiveness aspect and whether or not they'll be taking on more debt. But I will say that it's because of partnerships, I guess I'll put in a shameless plug here, that we're able to connect our members to other types of capital outside of federal resources. So for those who may not know, back in, I would say, mid-April, you know, BECMA and the Massachusetts LGBT Chamber of Commerce were able to announce the Futures Fund as a result of a partnership with Berkshire Bank in order to provide a line of credit up to $50,000 for our members, for Black business owners. And so that has been tremendously helpful. We've connected many of our members to that product and are looking to make sure that we're connecting our members to other resources. I know that the Business Equity Initiative had its own fund to connect Black and brown businesses with emergency capital. So we're continuing to work with our folks to make sure that we are providing, you know, these resources that unfortunately just don't exist at the federal or even the state level. And there are very, very few options at the local level. So.
You know, I'm glad you brought up the Futures Fund, because I think it is a perfect example of what we can do, you know, when we come together. And I just want to say, from the banking side, it was so helpful to have an organization there to say, no, we have businesses, like this product is going to be used. You know, you do need to advocate inside of a bank for, you know, for them to bank differently. And it's so helpful when you have organizations that can really help you connect the supply with the demand. You know, I mean, there's still $100 billion of PPP loan money out there. And, you know, the forgiveness stuff is coming down. And I think when you talk about like the concern and the worry of how things are moving, just to have those relationships and see, you know, okay, what can we do to really make sure that people feel comfortable with not only the PPP process, but other access. It was so great to be able to, you know, pilot that. And, you know, this is a line of credit that they can use for years and years and years. So they can continue to build it and expand on that as well. You know, so that's really exciting. I don't know if Mike is going to join us.
But I will say, you know, again, thanking Berkshire, because you all were also one of the first banks to open yourselves to new customers for the Paycheck Protection Program. And I just want to say, for the folks on the call, I do this everywhere I go. If you are a small business owner, if you if you lead a nonprofit, if you are an independent contractor, if you're a sole proprietor, you qualify for the Paycheck Protection Program. As Malia mentioned, $100 billion still available. BECMA and Berkshire and about 40 other organizations, technical assistance providers and lenders are part of this group called the Massachusetts Equitable Access PPP Initiative. And the entire purpose of it is to get as many Black and brown businesses in the pipeline to receive these monies, as well as working with them to get this forgiveness so that it operates as a grant and not a loan for us. So we urge people to apply as soon as possible.
Yeah, tremendous amount of information. And I hope everyone is taking notes, because I certainly am taking notes. This is really great information. We want to move to your questions and continue this conversation. But I think Michael wanted to make a quick comment before we move to comments from and questions from the audience.
Yeah, I think it's important. Malia said something that I think we sometimes lose sight of. This is a tragedy. Many businesses will be lost. It will disparately impact communities of color. But as we know throughout history, every tragedy, there's opportunities. And unfortunately, those opportunities don't usually benefit us, right? So we know with the Homestead Act in the latter part of that century and the Southern Homestead Act, we know with the Great Depression, we know with the war on poverty, huge dollars were invested in communities and individuals, and that we lost opportunities there. And I think we have to be thinking, when you're talking a $3 trillion federal relief package that they're debating right now, a $2 trillion package that they put in place, as Segun talked about, the PPP program. We got to have somebody at the table making sure that we have an equitable piece of that pie. And that's always important, that we're vigilant in that, because there will be people who do well out of this tragedy, whose businesses will thrive. Bailouts will put them in great positions. And we can't afford for that not to happen for Black business as well.
And Michael, you know, I want to keep you up here because I want to move on to the first question, which is basically, what kind of health disparities are we seeing for communities of color as we see these increasing rates of COVID-19?
Yeah, so I mean, we know that in communities of color, we have higher rates of, of diabetes, heart disease, certain types of cancer. The list goes on and on. They've been documented. We've discussed and challenged institutions for years around it. We now have a greater concept and consciousness around social determinants of health. It's not just because you didn't pull your pants up and you eat too much pork. It's about how you're treated, the communities you live in, the environments you're in, about really the taint of race and how African Americans and others are treated in this country that produces the health inequities that we're dealing with. We now know race matters to health. Where that ties into our conversation tonight is what the impact is on communities. We know that people are dying at high rates and they're Black and brown. Do they have the money, the resources to bury their loved ones? What does that mean in terms of lost income when you lose someone in the family who's not going to be able to help you build wealth? What does it mean when you can't pay your mortgage and you're being foreclosed on at some point when the moratorium ends on evictions and foreclosures? There is many repercussions of a pandemic that are medical, but result in economic effects on communities of color. We got to start connecting the dots. And there's probably no two better people I can think of than Malia and Segun to be on this call tonight to help us connect the dots between those chronic conditions, those social determinants, and the inequities that play out on the economic side.
Yeah, and that leads me to my next question from Yvonne Watson. And Segun, I'm going to ask you this. How can people of color support the economy for the businesses in our communities?
Yeah, that's a great question, Yvonne. I think there are a couple of ways. In the beginning of all this, a lot of us were really encouraging people to make their own investments in these businesses. So in the beginning, they were saying, to purchase gift cards and other things of that sort to support businesses. A lot of our food businesses are suffering because of this pandemic, and Commonwealth Kitchen has been a really great advocate on behalf of a lot of the food businesses here in Boston. And so making sure that you're ordering delivery, but from the restaurant itself, because we're also finding out that a lot of these platforms like Uber Eats and Grubhub are taking a lot of fees from these restaurants, and they're not actually earning a lot of money from this. So doing things like that. And I think supporting organizations that are advocating on behalf of these businesses is going to be really important as well. Michael mentioned in his opening comments about the work that Congressman Presley was doing, and it was because of some of the recommendations we were making that she was able to draft her Save Our Streets Act bill, which calls for the exact same things that we were pushing for, which was a dedicated fund for Black and brown businesses, technical assistance for these businesses, and the collection of data. First of all, she's a great example of why representation matters. But again, if this legislation makes it through, that is something that is very much beneficial for our membership, because of, these federal programs are first come, first served. So that's why we're not getting access. So, I would say that, finding these different, reaching out to your favorite businesses that you've been supporting, and finding out from the owners themselves how you can support their business, whether it's making purchases directly, if they're online, or other ways. I know, I tip my barber every week. You can't tell. I mean, obviously, I haven't seen him in a while. But I think there are all these different ways that we can support our businesses in the interim.
Thank you. And Malia, Kelly Chun wants to know, where is our leverage to make change out of all of this?
That's a great question. And, I'd love to add one piece to what Segun was talking about and really encourage corporations to look at their vendor lists, right? Because I think we as individuals can definitely do stuff. But if you work for a company, ask them where they're getting their toilet paper, where they're getting their paper from, and start building long-term relationships with minority businesses. I think that when you look at how we leverage, our money has power and we spend a lot of it. And being intentional about our dollars, being intentional about our attention, I think is very, very important. Obviously, we need to organize civically, we need to organize politically, but we also need to organize, or we need to understand that we have so much power. Your block, your neighborhood actually has so much buying power that if we decided to boycott something and stick to it, if we decided to demand that capital flow our way, we could make headway probably with a lot less work than we think.
Yeah, and speaking of the funds that are coming out of the federal government and ways to sort of help our communities, Mark Beaumont has a question for Michael, and that's, what is the status of the disbursement of the CARES Act funds as a safety net for hospitals?
Yeah, so there was various, what they now call, a big word that everybody's been using, tranches of money. And the original bill, there was $100 billion for providers, and people mischaracterized that as $100 billion for hospitals. It wasn't just for hospitals. And then there was another tranche of money, about $75 billion for providers. The problem here is that they're putting this money out, but are they getting it to the providers timely and in a way that they need it? We know that hospitals, particularly our community hospitals, were significantly impacted when they had to eliminate elective surgeries. They had to curtail a lot of their services and really direct their services to more COVID-19 related care. I know just from a health center perspective, your normal health center in our communities, Demick, Whittier Street, name it, saw 50 to 70% declines in their patient revenue. So if you can imagine, just from a business standpoint, you can't keep a business when you have a 50 to 70% drop in your revenue. So they really had to convert their business from primary care to urgent care. And thankfully for the PPP program, those who were able to access it under 500 employees, because if you were over 500 employees, you couldn't get the PPP. So some of them were able to access those funds. Credit to the state, Governor Baker was able to infuse some money in the health centers and hospitals to keep them afloat and make sure that they were there to be able to provide care. But across the country, I can tell you, hospitals, health centers are still hurting. I call it the adrenaline pump, right? When you're having a heart issue and you get the adrenaline pump, there's some money infused into you and you're amped up and you're ready to go, but it's temporary. And a few months from now, we could see the potential closure of health centers and hospitals if we don't do something.
And Michael, I think you also wanted to bring a slide back.
Yeah, if I could just show this really quickly, just so that we could look at what this means beyond just a business perspective and why there's such a rush to open up. I'm on the Reopening Advisory Board, I think is the title, that Mayor Walsh just convened. Mayor Walsh just convened, and we'll be meeting tomorrow morning. But I wanted to point out, if we bring that slide back up, why health is taking a back seat in many places to this economic crisis. Like in Georgia, when I'm talking to the Georgia NAACP president, who's a young brother, and he's pushing back when there are many Black and brown people dying. So I want you to see this slide. There's a loss of 20.5 million jobs nationally through April, including close to 1 million jobs in Massachusetts. We're now looking at a 14.7 unemployment rate in the US. That's 1 in 4 Massachusetts workers that have lost their jobs. Estimates are that Massachusetts could lose an additional 725,000 jobs April to June, which would push the unemployment rate above 22%. These are critical numbers, and I think we sort of get lost in this stuff, that we don't pay attention to what these numbers mean for us. A devastated state budget where there's deficits means cuts in programs and services that our families, our communities rely on, right? So whether it's food services or housing vouchers, or name it, or funding that's going into our Department of Corrections, or our youth service programs, our youth community programs. If there's a devastating impact on the state budget, if that $400 billion doesn't come out in this next bill out of Congress and give money to the states, that means that you'll see those impacts in our neighborhoods because those dollars won't come back to provide support and services in our communities.
And I have another question, and this could be answered by any one of you. This is a question from Rasan Hall, which I'm sure we all know from the ACLU. The term communities of color is often used interchangeably with the Black community. Why is it important to be intentional about directing resources to the Black community, and how do advocates and leaders deal with the white-Black backlash here?
Can I be the first one to take that?
Yeah.
From the position of the 38th floor. So first off, I think that it's important to understand that we have to speak truth about data. And when you look at data, what you see is that our economy is color coded. And that does mean something. So for example, our Friends and Family program is a model that we took from Oakland. And we had a long conversation with, internally with the bank, with the FDIC, with different folks about what does it mean for us to go into this space. And, I think that at the end of the day, you deal with the backlash the same way you deal with backlash of, being a person walking in the streets. You take it and you do your best work and you thrive and you succeed and you go high, as Michelle Obama reminds us to do. But you can't stop asking for what you need. So what I find is that I like talking about it from a data perspective. I do also talk about people of color, as a Black Puerto Rican Italian from Hawaii. I try not to get into the oppression Olympics too much, but we do have to understand that outside of the American Indian, the African American, experience and the Black experience now with the diaspora is one that affects, has a particular effect to quality of life, and that needs to be dealt with.
Anyone else want to comment on that?
Yeah, I mean, I'll just say briefly, because, first of all, I don't ever like when Malia goes first because she takes all the good points. I get this question all the time representing the Black Economic Council of Massachusetts and not the Minority Council of Massachusetts or the people of color. In fact, I remember last year when we held the Mass Black Expo, I received several texts and emails of folks asking, well, why can't we call it the Minority Business Expo as opposed to the Mass Black Expo? But I oftentimes find as well that it's only ever Black people that are supposed to be this all-embracing community, let everyone come under the tent and not focus specifically on our issues. But no other communities are ever asked to welcome everyone into their issues. There seems to be this understanding for everybody else that just because you're focusing on their issues doesn't mean that you're ignoring everyone else's. So there's something in the American ethos that whenever we're talking about Black, it means that we're being segregationists, even though we're not the ones that implemented that system. So, when I think of, Rasan's question and, good evening, Pastor, thank you for the question. How do we deal with it? I'll say first that it's not just the white gaze or that we have to deal with, because it's not just white people who ask that question. But I think it's all about being unapologetic in your not only your defense of, but your promotion of Blackness. And this, honestly, I think of Kelly's question of how we advance this notion of our worth to others. I mean, at the end of the day, if it weren't for Black people, America wouldn't have a whole lot of the stuff that it has right now. Its culture is completely dependent on the Black experience. A lot of the things that make money in this country are dependent on what Black people want to do and what they're into. And so, all of that, I think, buoys, at least from BECMA's perspective, all of the arguments that we make in our advocacy, the fact that we know America needs us and they know it too. And so it's really about the fact that we're no longer hiding the fact that we know, but instead advancing the fact that they can't do it without us. And so we need to move in that direction.
Absolutely. We got a question on the universal basic income, and Segun, you just spoke last, so I want to talk to you about that because this question is from Udapu, and I hope I'm pronouncing that correctly. But do you see a universal basic income as something Black communities can implement and sustain for ourselves? Maybe develop a system where we all pay into and take care of ourselves during a pandemic, a war, a market crash, etc.
Yeah, I think that's a great question. I wish I were the expert that could answer that fully. But from the limited, my limited understanding of universal basic income, I'll say personally, this is not on BECMA's behalf because our board has not discussed it, we haven't researched it. But I know that for myself, I'm fully in favor of a universal basic income. This is not a new idea. It's something that's been talked about in America for a long time. Martin Luther King was quoted earlier, and one of the things he was pushing for before he died was a universal basic income. In fact, he talks about it in his last speech in Memphis in 1968. And I know that there are several cities and towns across the country that are exploring this idea. I know there's a big town or a big city in California that's been doing this, and I think in New Jersey that's been exploring UBI. So, what I'll say is this pandemic, if anything, ought to be giving us the time and opportunity to rethink what the future of the economy looks like. We should not be clamoring to go back to the old way as usual. And so that's why, personally, I'm also not really for the reopening right now because we still not have figured out what that new future should look like and what it should be. But I do believe that any future economy should absolutely include universal basic income. At the end of the day, we have to take care of each other. And, the things that I've seen about UBI show that it can work. And I think we have to be open to exploring it at least because clearly the old way has not been working and will not work moving forward.
Yeah. And Malia, I want to direct this next question to you. This is from an anonymous attendee. I know I just spoke with Congresswoman Ayanna Pressley about some of the federal tracking of racial and ethnic data and what money goes where, and making sure we link that to folks who are actually impacted by the COVID-19 virus the most. But this attendee is asking, is there a way to monitor how much banks and credit unions donate to nonprofits and to folks who need it right now during this pandemic?
Absolutely. So most banks run their nonprofit giving through their foundations. And those foundations are ran like any other foundation. So they have to get audited, they have to do reports, and you can see not only who they're giving to, but you can also see what they're investing in, so what does their endowment hold? And I think, that's also a part of it. We talk about grants and those are really important, but grants don't build wealth. Right? Grants build dependence on benevolence. And I don't think that's what we're talking about when we're talking about the future of the Black economy. I think we're talking about self-determination, and I think we're talking about choices. And so I encourage everyone to look at your bank's corporate social responsibility report. Call your bank and ask, what is their CRA rating? Because that's going to tell you how they're loaning to people. Okay, and they have to give it to you. It's in every branch. It's supposed to be in every branch, and it's on every bank's investor relations page, or it has to be public somewhere for the bank. You want to ask these questions because, as I said, like for us, we have, we do about $3 million a year in our foundation. We do $3 billion a year in loans, right? So if we're talking how to get money from us, grants are a piece of it. But really accessing capital is important. And I think that, banks should use the foundation as a way to build relationships, and all of our customers should ask us about and should make sure that we know. So definitely look up a bank's foundation's, report, but also ask about their CRA.
Absolutely. Thank you so much. And our last question comes from Sue Fish, and this is for all of you. How do we go forward from here? We know the facts. We know that Black and brown communities, specifically Black communities, have been disproportionately affected on many levels for a long time. What's the best way to move forward from this pandemic so that we can come out of it somehow whole in a way?
Maybe I'll chime in first in that, and I think I've heard many speakers say that. Derek Johnson, who's the president and CEO of the National NAACP, says this. I heard Tanisha Sullivan, who's the president here in Boston of the NAACP, say this, and I think others are echoing this, that we have to take this crisis as an opportunity, and we got to seize the opportunity. So the opportunity here is, how do we address on the health side these long-term, long-standing health disparities that have us sicker and dying, living 5 to 10 years less than white Americans. We got to address that now. We cannot wait until the pandemic comes back, or the next pandemic, or the next Katrina. We have to address that now, because we know that we're losing lives. Malia and Segun, very smart in this stuff. We got to get together with the Terry Williams of the world at One United, the Daryl Settles, the others, the Glenn Lloyds, and have a strategy around finally making sure that we build wealth in a position that does not disparately impact us when we have a crisis like this. We are dying from both things. Dying because we're dying with debt, we're dying without resources. We can't go, many of our Black and brown folks can't run out to the grocery store and stock up on water and food like some of us can.
Better wear masks.
That and use this opportunity to really change this whole dynamic of how we live in this country. And I think we should be bold. We should be looking for, I've become a reparations fan in the last few years, Malia.
Wow.
The more I do research on it, you got Illinois, a little town in Illinois, where they tied their reparations to the marijuana tax. And now Evanston, and now have marijuana tax providing reparations for African Americans. Yeah. We need to really be bold like that now.
And, I just want to say on the reparations piece, clearly the country can do it, because they were able to marshal, as you mentioned, several $1 trillion to get out and figured out. I mean, I think of the PPP program, the fact that they were able to do that, or not even that, the stimulus money, the $1,200 checks that everybody got, clearly they're able to find who was alive, who was deserving of this money, and give them that money. So reparations is possible. It's just about the willingness. But I guess now I have to answer the question. In terms of how we move forward, I mean, first of all, again, I appreciate the invitation to be here, and any room with Malia and Crystal and Michael is a place that I want to be in, usually not talking, because I learn so much when they're sharing their expertise on so many issues, not only affecting our community, but the rest of the nation and the world. When I think of our movements forward, it really needs to come to an understanding on outside of our community that the development of some communities cannot coexist with the underdevelopment of others. Black communities have all the resources they need to move forward, and I think it was Martin Luther King, not to make him the subject of quotes all night, but he said back in 1965, if the inexpressible cruelties of slavery could not stop us, then the opposition we now face will surely fail. And so, when I think of this question of how do we move past this, I continue to have hope and rest in the knowledge that we will make it through. Our entire history shows that when we are faced with calamities, that we always come together to push past that. But, in terms of something that's tangible, BECMA's made recommendations on the federal, state, and local level on what outside of our community, what they should be doing, and continue to work with coalitions and other organizations on what we're doing to advance our own interests. I know that for BECMA, Malia, you mentioned getting masks when Michael was talking about what we have access to. We developed an online platform in order to generate revenue for Black and brown businesses who are producing this material, and to get it to our community, so that we're not only generating wealth, but we're also contributing to the health of our community. So I think, the support of all of these initiatives and these organizations is going to be really important as we move forward. And I'll stop talking there. Thank you all very much.
I just want to quickly say, and what I think we need to do to get metaphysical and to bring in maybe the divine feminine more. I think we need to center the divine feminine, and ultimately I think we need to love ourselves. We need to love ourselves unconditionally. And once we start doing that, everything that Segun and Michael said will flow to us. So not to get metaphysical, but they laid out all the tactics. Now we have to do the love yourself part, which was another thing that all of our ancestors and our founding freedom mothers and fathers have done.
Absolutely. And thank you all for all of your questions. And I want to give the panelists like a minute or so to give us some closing thoughts, maybe some closing action items for the folks who are watching at home. And Malia, why don't we go ahead and start with you?
I was like, did I just tell people love themselves? No.
I know, you already said.
Drop the mic.
Exactly, right? No, I mean, I guess what I want to just say is thank you so much. There's so much going on right now, and everyone is trying to figure out how we help one another. And it's spaces like this that allow us to talk about reparations in a time of COVID, that allow us to talk about the institutional and structural biases. Because if we're just reacting to COVID, it's going to be just like reacting to Katrina or just like reacting to anything else. But this one's too big. We can't do it. We can't do it again. So this time, let's love ourselves. Let's love one another. And let's thrive in the future.
Well, I'll just say that, I encourage those of you watching or participating to visit our website, BECMA.org, BECMA.org, or to visit protectma.com, which is the online marketplace for personal protective equipment. But when I think of, next steps after this conversation, I'm reminded of a proverb, Chinese proverb, that says, if you want 1 year of prosperity, grow grain. If you want 10 years of prosperity, grow trees. But if you want 100 years of prosperity, grow people. And so I'll just end by saying thank you to Malia and your leadership at Berkshire. Thank you to Michael and your continued leadership and advocacy in our community and in the health space. Thank you to Crystal for continuing to amplify the message of those who are often not heard from. Thank you to the museum for having this conversation and continue to be a pillar or an institution in our community. And thank you, GBH, for broadcasting this far and wide and all that you're doing to ensure that we're growing people, to ensure the continued growth and sustaining of our Commonwealth for generations to come.
And I'll chime in there to say the same. I'm a huge fan of both the other panelists, and I've been for a long time. I always look at Segun as really, he's a leader now, but I think there's so much more that Segun's going to do for this city and quite frankly for this nation. And I look forward to witnessing that. I will tell you this, that I think, to use an African proverb that some of the folks on the call have heard me use before, rivers that fell one drop at a time. If there was ever a time when I turn on my television and I'm traumatized again looking at the murder of Ahmaud Arbery, when I think about Tamir Rice and Michael Brown and the long list of folks that had us marching in the streets, when I think about the fact that we're dying and some people don't care, that quite frankly, some people don't care that Black and brown people dying of COVID-19. And this is America too. I want to say to everybody on this call, we got to mobilize, we got to organize. You need to get down with BECMA. You need to reach out to Malia and see what you can do to support the work that she's doing. You need to join the Urban League, the NAACP. This is not a time that we need to sit on sidelines and wait for somebody else to do it. If not you, then who? We got to mobilize and organize, because if nothing else, we're dying and it's time to stand up.
Absolutely. Thank you all for all of your words. I have a quote myself that I love, is knowledge is power and power is change. And you all have dropped some serious knowledge on us tonight, which is so important, especially as we work to move out of this pandemic and to elevate our entire community. Speaking of elevating our community and the resources that we have in them, we want to invite you to donate to the Museum of African American History. They put together this panel to make sure you had the information you needed to know going through this pandemic, but they're also working all year round to make sure that they preserve our stories and that we have a place for folks to both enjoy them and to be enriched by them. So the slide is up on your screen. They are open for donations because we are not open to go to them and patronize the museum. So we want to put a plug in for that. We want to thank WGBH for everything they do for us and for having this panel. I want to thank each of you, Malia, Segun, and Michael, for what you do in the community. You help us be better, do better, and work together better. And on behalf of Boston 25 News and myself, I want to thank you for joining here tonight and allowing me to moderate this panel and continue to bring you the stories that matter. So have a great night. There are going to be more resources with this registration here. We want to thank Leon, Jackie, Malika, who are behind the scene, Annie, all of the folks here that made this possible tonight. Continue this conversation at home because this is so important, and re-watch this panel because I took notes, but I'm going to go back and collect more of those gems because again, this information matters, the work we do matters, and elevating our community matters. So